Hello, today we're going to talk about the tooth anatomy. It consists of three parts: the crown, neck and root. The visible portion of the tooth, which is above the neck and extends out of the gum tissue, we call it the crown. The crown is covered with a protective layer called enamel, which covers the dentine, pulp chamber and the pulp. The neck of the tooth is also called cemento-enamel junction and or cervical line. We call it the cervical line or cemento-enamel junction. This allows for attachment of the gingiva or the gums, and this is where the crown's enamel layer meets the cementum layer of the roots. Okay, so here we have, this is so we said that the tooth is divided or consists of three parts: the crown, the neck and the root. And we have here, this is the enamel, which is the hardest tissue in the human body. It is normally white in color, okay, and it is above the neck, okay, and it covers the dentine, the pulp chamber, and then finally inside the pulp chamber we have the pulp, and then we have the blood vessels and nerves, okay. And then the second part, we have the neck, which is we also call it the cemento-enamel junction or the cervical line. Here we have, it is the meeting, okay, it's the place which allows for the attachment of the gingiva or the gums, okay. And this is where the crown enamel layer, so it is where the enamel meets the cementum. Can you see? This is the meeting point, okay, between the enamel and the cementum, okay. So the enamel of the crown and the cementum of the roots. Then we call it what it has to, we call it cemento enamel junction, okay, or we call it the cervical line, okay. Then we go to the roots, okay. The root, which is the larger portion of the, finally this is the root, okay. It is the larger portion. It extends from the neck to the apex, from the neck here to the apex. This is the apex, okay, and it secures to a socket, or allows the tooth to be secured in the socket, or the socket. There's another we call it another term, we call it the alveolar process in the mandible, or in case of maxilla we call it the jawbone, okay. So the function of the root, it secures the tooth in its socket, okay, or the alveolar process in the mandible, or in maxilla we call it the jawbone. So it's for securing the tooth in the socket. The enamel covers the crown. This is the enamel part. This is the enamel, okay. It covers the crown, and the cementum covers the root. So here, this is the enamel. We said it's white in color, and the cementum covers the root, which is yellow in color, okay. The tissue in the enamel is made up of non-living tissue, or it's a dead tissue. It's made up of hydroxyapatite, which is the hardest tissue in the human body. This enamel can be dissolved by acids produced by dental plaque, okay, or acid or patients eating acidic food. This may lead to the cavity formation. Okay. In case of dentine, okay, dentine is the hard tissue that is it is yellowish in color. Can you see? As you can see here, it is yellowish in color, okay. And it is hard tissue also. It is deep to enamel, okay. It is deep to enamel, and it's formed by cells called odontoblasts, and it's made up of the dentine is made up of 70% minerals, harder than cementum, okay, and softer than enamel. So the dentinal tubules run through the dentine in parallel, and it originates at the pulp cavity. They transfer, so these dentinal tubules, they transfer nutrients from the pulp, okay, because pulp is a living tissue, okay. It transfers nutrients from the pulp to the dentine, okay, through the dentinal tubules, okay. Okay.